Senator Rivera, thanks so much for being here.
Pleasure to be here, sir.
So it was late in February that we heard testimony from Health Commissioner Howard Zucker at the health budget hearing, and he was asked a lot about nursing homes. This was a long-awaited hearing. He was there for 5 hours. Lawmakers asked him quite a bit of questions about nursing homes. Did you get all your answers? Are you looking for anything else at this point?
We did not, and I would remind folks that these are hearings that are about the current budget proposal that the governor has. So certainly it was an opportunity for us to ask him about nursing homes, but it was also an opportunity for us to ask the administration about why they would continue to insist that they have to cut Medicaid during the middle of a pandemic, because we are still in the middle of a pandemic. We're talking about 1% across the board cuts, about $500 million in public health cuts to the city of New York, $200 million to safety net hospitals and federally qualified health clinics around the state on the issue of a pharmacy carve-out. I mean, these were the things that we wanted to ask him about. And in many instances, the answers, we did not find the answers. And that's just this administration, that's par for the course for them.
So I want to come back to Medicaid, but on nursing homes, what are you still looking for? What information do you want to know? I know that Republicans were looking for emails in the Cuomo administration. What are you looking for?
What I think is most important is that they need to be, this is the reason why I passed my bill related to data transparency. We need to make sure that all the data that they have related to individuals who died and passed away in hospitals, but were residents of nursing homes, that data needs to be absolutely clear. And the reality is that they have, as soon as the Attorney General produced her report, within hours, the numbers magically appeared, the ones that they insisted they needed to count and recount and recount. And I'm still not certain that we have everything. So, but we are still moving forward. It's the reason why we passed those bills and why we will pass more bills in the weeks to come. And we're in conversations with our colleagues in the Assembly to make sure that we can get some real changes done to actually avert unnecessary deaths in the future.
So you mentioned the hearings from last year that were specific to nursing homes. As you said, the most recent hearing was just about the health portion of the state budget. I'm wondering, during those hearings last year, and as you've thought about this issue, obviously quite a bit, do you think those deaths at nursing homes were made worse by management at nursing homes, or do you think it was actions of the administration, or is it a combination of both?
I think it would be a combination of both, and there were decisions that were made in small groups of people, like very smart and capable people who were advising the governor, but ultimately they just talked to each other. They did not include the legislature. The emergency powers made sure of that.
Right.
And they talked to experts that they wanted to talk to, that told them what they wanted to hear, and ultimately the things that they did were about making the governor look good, not necessarily about solving the problems of New Yorkers. So whether it was around nursing homes or testing or the rollout of vaccinations or closing of schools or closing of restaurants or closing of the state, all of these were just this style of leadership from the governor on steroids, where he didn't have to talk to anybody, and it was just how can we do this so the governor kind of looks good. Maybe gets a couple of extra chapters in this book that he found time to write, but not necessarily about addressing the issues that New Yorkers actually need addressed.
And I should mention, we know from the New York Times now that the governor wasn't necessarily communicating with the staff level at the State Department of Health. Mm-hmm. And there's a disconnect there, I think, between what lawmakers see him doing and what is actually going on at that agency. But I want to just revisit nursing homes one more time. Some critics of the facilities have said that maybe it's a bad idea to have some of them be for-profit because there's a financial incentive sometimes to maybe cut some corners for services. What do you think about that? Should we make nursing homes completely not-for-profit in New York State? Would that benefit people?
Well, I actually introduced a piece of legislation along with my colleague in the Assembly, Dick Gottfried, that would actually stop the issuing of new licenses for-profit nursing homes. And let's be clear, there are for-profit nursing homes that take care of their patients. But we have to make sure that we tighten the rules so that we disincentivize those bad actors that ultimately want to make money and not serve people. Those are the types of things that we need to make sure that we do, which is why we passed the bills that we passed a couple of weeks ago. And one last thing that I want to definitely touch on is the fact that for a long time, the rates that have been paid to nursing homes are rates that actually make it almost impossible for nonprofit nursing homes to be able to operate. And that is an enormous issue. It's the reason why there's been a transition at this point. 2/3 of the nursing homes in the state of New York are for-profit nursing homes. and which has made it, because the rates in particular have made it very difficult for nonprofit nursing homes to continue to operate. So it is obviously a multi-headed problem, and we're doing what we can to tighten up the rules and ultimately protect the most vulnerable among us.
So let's circle back to Medicaid, because I think that's hugely important. I was watching the health budget hearing, and I kept on hearing about Medicaid cuts from you and a few other lawmakers, questioning the health commissioner. I know you explained it at the top of the interview, but can you go through what these Medicaid cuts are from the Cuomo administration that they're proposing in the budget?
Yeah, well, there's a couple of things that happened last year that could not go into effect, because having them go into effect would have actually changed some rules, would have made it impossible for us to get the federal money that was because of the pandemic. There's also a 1% across the board cut. There is a process that it's called the pharmacy carve out. It is a transition of the pharmacy benefit that it's complicated, but the core of it is that it would actually make it so that federally qualified health centers, safety net hospitals, and what are known as Ryan White providers, which are HIV positive providers for HIV positive patients, use a federal program called 340B that saves them money when they're purchasing drugs, and they use that money to invest in care for the most vulnerable. And the governor's changes in this budget would actually make it so that they would no longer be able to do that, signifying a cut of about $200 million to safety net hospitals and federally qualified health centers across the state. And that's just the top level stuff. And the reality is that we can go very deep here, but at the core, the governor is continuing to say that he's going to cut Medicaid, and continues to resist raising taxes on the wealthy, which should be the first conversation that we have. How do we actually get more revenue by taxing those among us who have continued to get wealthy during this pandemic while the rest of us has sacrificed? So this is why I fought him last week, and I will continue to do so that we get a fair budget in the next couple of weeks.
All right, well, that's a very important conversation in the state budget that we'll be watching in the next few weeks. Senate Health Chair Gustavo Rivera, thanks so much.
Pleasure to be here.